Okay, I'm going to do some trach care on my patient. Before doing that, I went and gathered my supplies. I made sure to bring an ambu bag, a trach care kit, an oxygen or trach mask, oxygen, and some sterile suctioning, and a syringe, um, and check my patient's chart and make sure everything's good. So I go into enter the patient's room. Knock knock. Hi, Mrs. Smith. My name's Kate. I'm from respiratory care team here. We're going to just do some trach care, okay? So the first thing I would do is assess the patient. I'll go ahead and wash my hands and put on some gloves. Mrs. Smith, how's your trach feeling? Is it irritated at all? Is it bothering you in any way? Go ahead and listen to your breath sounds real quick. Takes a deep breath for me. Another, and another. Okay. I would also go ahead and check the cuff pressure, make sure it's within range, 20 to 30 centimeters of water or H2O. And then I'm going to go ahead and start the procedure. So the first step of the procedure is to suction, and suctioning is a sterile procedure. So I'll go ahead and oxygenate my patient, hook up to the oxygenator, and I'll go ahead and take out my sterile suctioning kit. So this is shown in the kit. There's a left and right hand side. It's a sterile procedure, so I'm going to go ahead and have one clean hand. My left hand's going to be my clean hand. My right hand is my sterile hand. Go ahead and grab my gloves. Also, upon entering, I did make sure I brought a suction kit, and it is set up. Suction is going to be between negative 120 and negative 150. Okay, I have my clean and my sterile hand. I'm going to go ahead and make sure I put some into the catheter, grab the catheter, hook it up to the suction up on the wall, and I'm going to put some lube on my right hand. Okay, went ahead and made sure it's properly lubricated, and we'll go ahead and insert. Once I feel some resistance, I know I'm at the carotid, I'll back up a little bit, hit or occlude the thumb port and suction. Again, no longer than 15 seconds to do that. Now that it's nice and suctioned out, is done, I'm going to go ahead and remove the inner cannula here. Some patients have a disposable, most patients now have disposable inner cannulas, but there's some other trach models that they need to be clean. So, here we have other gloves in here. That is not an aseptic technique, unlike the suctioning part. We'll just hyperoxygenate her again. Take some deep breaths for me. Okay. So we're going to go ahead and remove the inner cannula here. Making sure to secure the flange of the flange of the trach so it doesn't come, you don't take it all out. The inner cannula, if it's a disposable one, you can go ahead and toss it. We always have with our trach patients in the room a size smaller and a size larger, just in case of we need to change it if there's some swelling or if there's anything, the anatomy changed a little bit of the patient. We'll go ahead and have that readily available for the patient. This is a disposable one, so we'll just go ahead and toss it. But if it was a one that wasn't, we can go ahead in our kit here. Pipettes, and you can clean it like this in the sterile solution. Here, and there's gauze that you can go ahead and let that out to dry somewhere safe, so it won't get bumped or anything like that. So then we're going to go ahead and remove the gauze that's around the trach. We'll go ahead and dispose of that, and in the kit there is a brand new one. So we can now begin our sterile I'll go ahead. Q-tips that I have another sterile saline, and they come in little plastic, so you can go ahead and just saline right into the Q-tip bag, and we'll go ahead and clean from the inner portion out, and then dispose of the Q-tip, each one. Use a new one, clean from the inner portion out. I would go ahead and change the tie that would be around the trach. The kit usually has one with it. And go ahead and change that out. And now that it's all clean and sterile, we can go ahead and put a new gauze back on. While we were cleaning it, we want to make sure that there's no redness, irritation, and if there were, we need to notify the doctor or the nurse as soon as possible. So we can go ahead and make sure we put the gauze back on there to absorb any moisture, anything, and secure our ties around Mrs. Smith's trach. We can now assess the patient, make sure that Mrs. Smith is comfortable. I'm going to go ahead and listen to her breath sounds. Take a deep breath for me, deep breath, and deep breath. Good. I monitor, make sure, check the cuff pressure again, and it's still in between that 20 to 30. And yeah, just monitor her vitals and make sure that the patient is comfortable and breathing easily. We want to go ahead and do trach care at least 2 times a day, so we'll need to correlate with the nurses to see